ครับสวัสดีครับ My name is Dhave Setabutr and I'm from the Department of Otolaryngology-Head and Neck Surgery at Thammasat University. And today we're going to be going over clinical terminology. So for today's lecture, we're going to be talking about clinical terminology that's used to relay information both to patients and fellow physicians alike. An outline of what we're going to be talking about today include conventional directions, how to interpret imaging, and how to relay this information to your fellow colleagues or to the patient so that they can understand what's going on with them. Prefixes and suffixes we'll take a look at, but for the most part, we'll review some terminology that you might be unfamiliar with in the prepared lesson that you should have read prior to today's lecture. So we'll talk about, first of all, some directions that's used to describe anatomical landmarks. As you can see depicted in both the picture on your right and the left, we have medial, which means towards the midline. We have lateral, which means away from the midline. Of course, you have right and left. Something to pay attention to when looking at images, including photographs as well as CT scans, x-rays, etc., is that the patient is always facing towards you in the picture presented. You have anterior and posterior, anterior of course meaning forward or in front of, posterior meaning behind. You have dorsal, which is synonymous with the dorsum, also meaning the back, or the ventral aspect, meaning the front aspect as well. And then of course you have terms like superior and inferior to establish terms for moving up versus down along the spine. So next we're going to go over ways to interpret imaging in a very basic and standard way. This way you can easily interpret any type of image that comes across you in the hospital or in the outpatient clinic setting. So let's start with this chest x-ray. First and foremost, you want to make sure you have the correct patient. So what does that include? You just need to know the patient's name. So first and foremost, before I present any type of imaging, I want to restate the patient's name. Second of all, I want to know the correct date. I want to make sure that this x-ray or this CT scan or this MRI that I'm reading is from the date that I'm actually paying attention to. I don't want to accidentally read an x-ray from 2 days prior after I've already treated the patient with a medication, because then that's going to give me false information when determining what to do next. Then I want to list the exact type of x-ray or imaging that I'm looking at. Am I looking at a chest x-ray as visualized here? Am I looking at a computed tomography or a CT scan? Am I looking at an MRI or magnetic resonance imaging? Am I looking at an ultrasound? So again, there's a multitude of types of images that could be displayed. Anything from an x-ray as visualized here to a photograph that could be used in the medical field. So let's review again. So again, say for this hypothetical patient, I would state their name, state the date that the image was taken, and then state what type of image I'm looking at. And then lastly, I also want to state the direction that I'm looking. So in this situation, this is what we refer to as an anterior-posterior chest x-ray. So I would state the name, the date that again it was listed, that this is a chest x-ray in an anterior-posterior view. And then I would find any other attributes of the x-ray or image that I would find pertinent to relay to the other listener. Something to remember, and we'll go through this in a step-by-step fashion, is that when looking at an x-ray or CT scan, the patient is typically facing towards you. So let's try. These are some of the planes that we'll be looking at, and we'll go over in a step-by-step fashion. You can see the transverse plane is equivalent to what we will call an axial view. We have a sagittal plane, or the sagittal view, and then we'll have a coronal plane as depicted in this cartoon. Additionally, these terminological or terminology can also be used as visualized in photographs. This is what is typically taken before a patient undergoes a rhinoplasty or a nose job. So just as we look at x-rays and use medical terminology to depict x-rays and other type of imaging, we'll do the same when we look at photographs as listed here. So these again are examples of some images taken prior to a rhinoplasty. Although you may not need to know the technical terms, the first one seen is a frontal view, the second one is a lateral view, the third view is an oblique view, and the last one is a view from the nasal base. So now let's go back to those images that we talked about and what you will heavily use during reading CT scans. This is what we call a sagittal view. Again, remember that cartoon we looked at a little bit earlier. So this is also commonly referred to as a lateral view. This view is a coronal view, or what we typically might say is a frontal view. Again, the patient's right is visualized as the patient is facing towards you. So in this picture, what I'm pointing to would be on your actual left. A top-down view means taking axial cuts from the top all the way down to the base. So depending on what type of view setting you're looking at, from the head to the abdomen, chest, etc., you will describe at what aspect of that level you're at. In terms of terminology, I won't take a lot of time to discuss various terms that you might see in a prefix and a suffix setting, but we will go over some of these prefixes and suffixes that you might find unfamiliar with you in class later on this week. Another useful terminology is ipsilateral. Ipsilateral means the same side. Contralateral obviously means to the opposite side. So this becomes important when you need to know when nerves cross as they descend from your brain all the way down your spinal cord to their varying organs. Additionally, you want to know, depending on, say you have a malignancy on one side of the body, if it has metastasis that goes on to the other side of the body. So lastly, that's it, and we'll go over a lot of this in class, but this will give you a brief overview of what to expect. Have any questions? Email and line ID are provided as follows.